There are troubling new signs that the coronavirus is getting more infectious. While death rates are down across the U.S., we're still seeing about 64,000 new COVID cases a day. And now a more contagious variant, first detected in the U.K., has become the most dominant strain circulating here. It's threatening to undermine our nation's vaccination efforts. For more on this, I want to bring in Dr. Leo Nissola. He's an immunotherapy scientist. Doctor, before we even get into some of the discussions here, there are some people, I've had friends, text me and say that what they are seeing in the media is scaremongering, fear-mongering, that in fact we are doing well in the United States, that more and more people are getting vaccinated. And so to those people who are concerned that this is much ado about nothing, break this down. What are you seeing, in your opinion, in your understanding of what we're facing right now in the United States? Just break it down, because one of the things that you hear is, look, this idea that children are now becoming infected, but we haven't seen children dying at the level that we've seen others. Am I right about that, or just state what you know?
Yeah, thanks, Vlad. I think it's a very important point, but it's not a surprise. We expected that B.1.1.7 would become the most dominant strain because it's more contagious. Now, some of these recent clusters of infections were found to be in younger population. Now, with states reopening, that sort of was expected, as kids are more likely to break away from these risk mitigation measures imposed by counties. As we move into this new phase of the pandemic, even though the United States is vaccinating millions every day, it's important to continue to practice those risk mitigation measures that we know work. Now, it's important that we understand that while vaccinations are still taking place, these new variants impose a challenge while trying to curb the spread of the virus.
All right, so just 5 states account for nearly half of all new cases in the U.S. And as I said, there are a growing number of infections among children. I was surprised to actually learn that New York is one of those 5 states. So what concerns you the most about all this?
Well, we are trying to outpace the virus by vaccinating 3 million people every day. Now, Dr. Walensky mentioned that seeing the decreased number of deaths may be due to the vaccination efforts. And if that truly is the case, we are winning. So I think it's important to put into perspective the amount of work that this administration has done since the beginning of the year to get us to this place where we are right now, being able to see a light at the end of the tunnel, which for me particularly, I could not have seen that coming. I think we're in a better place than I expected us to be because of the vaccination campaign and the strategy of the Biden administration is actually working. I'm surprised by that, and I'm very hopeful with that information as well.
So there's new research submitted to The Lancet in late March, which found episodic spikes of COVID-19 cases after fans attended NFL games last season. Explain what that means, and based on that report, is it safe for fans to be allowed into sports arenas and stadiums, especially with baseball season sort of ramping up? And is there a way to do it safely? I note that, for example, there are games happening here in New York City, but it's nothing in terms of the restrictions that are in place in New York City. It's very different from what we saw in Texas.
Yeah, for me, it's pretty clear, and it's very simple. Unfortunately, I don't think we are in a period that we need large gatherings, and allowing large gatherings impose a public health threat. The general rule is that if you are exposed to something, the longer you're exposed, the more likely you are to become infected. So if you're sitting there next to someone who is sick, coughing, sneezing, drinking, yelling, talking, you are likely to become infected as well. So folks going to large gatherings while we are still in the middle of the pandemic with variants that are more contagious, still being spread through community spread, you are likely to become infected or carrying the virus with you when you go away. Now, it's safer than spending hours in a crowded bar because it's still outdoors. But still, COVID-19 spreads from person to person, more commonly by droplets. And when this virus is projected through someone's cough or when someone is speaking or yelling, you are likely to encounter the virus. And if you get these aerosols into your nose and mouth, you are likely to become infected too. So after this virus is projected from someone's mouth, it can linger in the air. So for me, large gatherings are a mistake. Unfortunately, we're not ready for it yet. And I would just urge people to hold on a little bit longer until we get more people vaccinated before returning to these large gatherings.
Regulators in the UK are now recommending that the AstraZeneca vaccine not be given to anyone younger than 30 following reports of rare blood clots. Why is age a factor?
Well, AstraZeneca has a puzzle that I have not yet fully comprehended. Since the beginning of their drug development process with their clinical trials, there have been many, many challenges. Now, they were the first vaccine that was approved in the UK, and they have vaccinated millions of people with this vaccine. What they did find now is a rare blood clot disease in some patients. And because of that, regulators from the UK, in communication with AstraZeneca, have decided to backtrack the approval and just allow this vaccine to be for a specific age group. Now, it's important to understand how blood clots are formed and what populations are more likely to develop this disease. And researchers are now trying to understand if this affects only folks who are smokers or are on birth control or some other clinical features that allow for these blood clots to occur. But the answer is not clear yet.
All right, Dr. Nissola, always great to have you. Thank you.
Thanks for having me.